in the first session, I then tell the patient that, as I explained to you on the phone, we are going to talk for 3 sessions. Each session will be about 45 minutes, give or take a few minutes. And I tell them that in the first session, I would like you to begin wherever you want to, because I want to see what is of utmost importance to you today. I don't want to assume that it is what you mentioned on the phone. I don't want to assume it is something from your childhood. So please feel free to start wherever you want to. I wouldn't even say necessarily, please tell me how I can help you. Because I've had patients who said, I don't know that you can, or what makes you think you can. So I've had all kinds of responses over the many years I've been doing this. And so I start that way, in the way that I just said, that feel free to start wherever you want to. And I say to them that in today's session, I'll be letting you talk freely. I might not say much. I might intervene at certain points. But if I do, it'll mostly be to clarify things that are puzzling for me or I'm not understanding. And I might ask an occasional question, but for the most part, I will let you take the lead. And I tell them that in the second session, at some point I might have more questions, and if so, I'll let you know. And usually in the third session, I've reviewed the notes from the first 2 sessions, and there may be things I realize I don't know much about, so I might ask you more questions then. And I ask their permission to take notes for the first 3 sessions, because I feel that's important, and I explain to them that I'm taking notes because it'll help me remember names and dates and important facts later. And usually people say, of course, yes. Occasionally I've had people say, no, I'd prefer you don't take any notes at all. And if that happens, I honor their wish. So I let the patient begin where they might want to. And I do tell them also that please do not worry about being haphazard. So don't worry about where you're going or can I follow you, because I'll be listening in a particular way and I will figure out a way to follow you, okay? Now, that is for the patient, but here, for the purposes of this seminar and discussing things with all of you, what I think is important is that each of us has some kind of a model. We may have a very broad model, we may have a narrower model, but we have a framework that in which we listen to the patient's history. It may not even have a name. You know, it could be. Somebody might listen based on modern conflict theory. Someone might listen based on object relational theory, on self-psychological theory, on interpersonal theory. So we can have many different ways of listening. And some people don't care about those theories at all, any of them, and they just listen in their own way, which is also fine, okay? But whatever it is, what I'm trying to convey to you is that we have a way in which we organize material in our minds, okay? And without saying that explicitly, that's what I'm trying to convey to the patient, that I have a way in which I'll be thinking about the patient's life history chronologically. Whenever they might tell me things, they might tell me in the first session, the second, or the third, but I will organize it ultimately about in terms of what happened to this patient, when, what happened in the first few years of their life, what happened in the first year, what were the major losses, who were the people they leaned on, who were the people who supported them. You get my drift. So I listen to all of that and I'm organizing that.